How parks improve mental health. The science behind green spaces. Could your neighborhood park be the secret to a healthier, happier life? Many of us dream of having green spaces just steps from our doors. But here's the twist. Simply living near a park won't automatically boost your mental or physical health. Surprised? There's a lot more to this story than meets the eye. A groundbreaking study, Impact of Green Spaces on Mental and Physical Health, was unveiled at Guimarães Landscape Laboratory, drawing attention from leaders like Mayor Domingos Bragança and top environmental and health officials. The research was a collaborative effort between the Landscape Laboratory, the University of Minho School of Medicine, UMinho, and the Higher Institute of Health, ISAVE, and it set out to answer a deceptively simple question. Does proximity to green spaces really make a difference in people's lives? The team surveyed 501 residents living at varying distances from Guimarães municipal parks. Using interviews conducted from March 8 to 24, 2025, the participant pool reflected a mix of ages, genders, and neighborhoods. Crucially, respondents were split into two groups: those living within 300 meters of a park and those who lived further away. They were asked about how often they visited green spaces, their perceptions and habits, as well as impacts on their sleep, anxiety, stress, and depression. And this is the part most people miss. Living close to a park by itself had no statistically significant effect on psychological symptoms or sleep quality. Instead, the real game changer was frequent use. Those who often spent time in green spaces enjoyed less anxiety and stress, as well as better sleep. Evidence for a connection with reduced depression was found. But interestingly, factors like income and job status played a significant role here too. When it comes to physical health, distance to parks does count. People living further away tended to spend less time being moderately active, such as during walks or mild exercise. But the clearest pattern was this. Regular, intentional use of parks consistently led to higher levels of physical activity and overall wellness. Here's where the debate heats up. Wealthier residents tended to place greater value on the existence of parks, yet visited them less frequently. Contrastingly, those with lower incomes were the most active users. Could this mean that public investments in parks most benefit those with fewer resources? The researchers certainly think so, emphasizing that simply building parks isn't enough. Cities need policies and programs that actually invite and support the community in making the most of these green spaces. Pedro Morgado from the University of Minho puts it bluntly. Nature only creates a positive impact on health when it's woven into our regular, lived experiences. For him, just having a park nearby accomplishes little if people don't feel motivated or able to use it. Real change requires improvements in park access, safety measures, organized social and fitness programs, and even initiatives that draw children and schools into these green environments. Supporting these findings is Guimarães' ambitious Radial Green Strategy, a plan setting the city on course to be named the European Green Capital in 2026. The city is developing 3 concentric rings of green space, 1 urban and 2 sprawling belts stretching 20 and 42 kilometers, which will eventually connect parks and trails for easier access. Executive Director Carlos Ribeiro points out that one of the study's main takeaways is already being addressed. Such infrastructure projects help break down barriers preventing residents from taking advantage of green spaces. The largest ring is projected to serve nearly 3/4 of the local population. These ideas are already taking root through the pioneering Bairro C project, an effort to revitalize urban neighborhoods by weaving 11 kilometers of green corridors into city life. Over the past decade, Guimarães has expanded its green areas by 95 hectares, boasting 2 major urban parks on its eastern and western flanks, each dozens of hectares large. Looking even further ahead, Guimarães is committed to reaching climate neutrality by 2030. A core part of this pledge is the Pegasus Environmental Education Initiative, which has engaged over 19,000 students and 1,700 teachers, nurturing a new generation of environmentally conscious citizens. The study itself draws from the innovative One Health and Exposome models, recognizing that our health, the environment, and broader ecosystems all interact, shaping our lives and well-being in ways we're just beginning to understand. But here's where it gets controversial. If building parks alone isn't enough, how should we be rethinking our investments in public green space? Should cities pour more resources into programs that help people actually use these spaces? Or is the very existence of green infrastructure the true priority? And what about the unequal benefits between different social groups? Is this the best way to close health gaps? Or could these findings backfire? What do you think? Are frequent programs and better access the answer? Or do you believe simply having parks nearby is valuable in its own right? Let us know your thoughts. Where do you stand in this growing debate? How planting trees can save lives. The hidden benefits of urban greenery. Imagine a simple solution that could save thousands of lives in major cities worldwide. It's not a new medicine or a technological breakthrough, but something as natural as the air we breathe. Trees. A groundbreaking study has revealed that planting trees in urban areas can have a profound impact on public health, and it's time to take action. Researchers analyzed data from 744 European cities across 36 countries, examining the relationship between tree cover, air pollution levels, and mortality rates. The results were staggering. Every 5% increase in tree canopy cover could prevent approximately 4,727 premature deaths related to air pollution each year. Moreover, reaching a canopy cover of 30% in each city could prevent a whopping 11,974 premature deaths annually. But here's where it gets even more compelling. This isn't the first study to highlight the health benefits of green spaces. Previous research has shown that living near trees can improve heart health, slow cognitive decline, and even help combat rising global temperatures by storing carbon. In fact, a single tree can absorb an average of 22 pounds of carbon dioxide per year during its first 20 years of life. So, what's holding us back from planting more trees? The authors of the study acknowledge that reaching their recommended mean tree coverage could be challenging, especially in dense areas or regions facing water scarcity. However, this shouldn't deter us from taking action. As the study suggests, targeting not only public spaces, but also private areas like residential yards and peri-urban regions could be key to achieving the recommended 30% tree canopy cover. Meanwhile, communities around the world are coming together to make a difference. Initiatives like MasterCard's Priceless Planet Coalition, which aims to plant 100 million trees by 2030, and a Detroit partnership striving to plant 75,000 new trees across the city, are just a few examples of the collective effort to create a greener, healthier world. So what can you do to help? Start by supporting organizations that prioritize tree planting, or join local initiatives in your community. You can also make a difference by using eco-friendly search engines like Ecosia, which has already planted over 150 million trees. Every small action counts, and together we can create a world where trees are valued for their life-saving potential. The question is, will we take action to harness the power of trees and create a healthier, more sustainable world? The answer lies in our collective willingness to make a change. Share your thoughts. What do you think is the most significant barrier to planting more trees in urban areas, and how can we overcome it? Unlocking mental health. The benefits of urban nature. Nature isn't just a pretty backdrop. These studies reveal its profound impact on urban mental health. Imagine stepping into a bustling city and finding calm amidst concrete. This analysis digs deep into how urban nature transforms lives, drawing from 54 acclaimed studies and over 30 leading researchers. Here's the full picture, reshaped for clarity and curiosity. Study transparency, open data for trust. But here's where it gets controversial. Researchers shared every data point and all code publicly. GitHub. Pro tip, transparency builds credibility, right? They pulled global maps from Free Natural Earth and urban density stats from the European Commission's Human Settlement Database. This isn't just academic, it's a blueprint for reproducibility. The science studies, key takeaways. Let's break this down with highlights that spark debates. 1. Urban green spaces. Meta-analyses link trees, parks, and gardens to stress reduction. Shanahan et al. 2016. And depression relief. Rosa et al. 2021. Wait, some argue blue spaces, like rivers, might trump green ones. 2. Cultural factors. Did you know cultural attitudes toward nature influence mental health? Haas et al. 2021 found this in COVID-era studies. But how universal is this? 3. Smartphone science. Bacolis et al. 2018 used apps to track real-time mood as people interacted with urban nature. Score 1 for modern tech in mental health. 4. Biodiversity lightning round. Here's the kicker. Studies in Canada found mental health boosted by biodiverse cities. Oxton et al. 2024. Is this just ecosystem speak or a roadmap for urban planners? Methodology, behind the scenes. And this is the part most people miss. Data sources. Global human settlement. Maps human density citywide. Natural Earth. Base maps for cross-country comparisons. GitHub. Code process data for DIY replication. Key studies. Focus. Findings. Circles dates. Depression parks. Exposure 1 hour week helps. Rosa et al. Coastal proximity matters in England. Garrett et al. 2019. Bird life mood. Real-time benefit tracking. Hamoud et al. 2022. Controversy corner. Debates questions. Nature isn't a band-aid. Lund et al. 2023 argues systemic changes beat brief exposures. 1. The dose debate. How much urban nature do you need? Always. From 3 minutes per day, 30-plus daily encounters, 300-plus medic hours per month. Team, not one size. Phone app data shows vary benefits per person. Kondo et al. 2020. 2. Equity concerns. Is urban nature a luxury for the privileged? Yes. Socioeconomic factors, mentioned in GHQ12 PSS tools. But. Studies in Santiago. Perez Silva et al. 2023. Found green cover boosted kids' outcomes across income levels. We want to hear you. Would you live in a city with 20% green spaces or coastal views? Share your preferences below. And this, what's missing in urban nature studies? Cultural diversity? Age-specific needs? Let's discuss. INDA filter where? Lame-S. A freehand of everything. A freehand of everything. Dot.